So I am Dr. Tim Kelly, and I'll be doing your orientation tonight. So B.J. Palmer said, "You never know how far-reaching something may think, do today will affect the lives of millions tomorrow. Get the big idea and all else follows." And that's really what we'll talk about tonight, the big idea of healthcare and ultimately where health comes from. Because what would you rather have, your health or pain relief? What do you think? Health, right? And we'll talk about some instances where you say to yourself, well, gosh, that does make sense. You could have a hangnail, have lots of pain, but be pretty healthy even despite the fact you have lots of pain. So the presentation objective is, one, to understand our present healthcare system, enable participants to realize where pain comes from, how to get out of pain, and really, more importantly, how to stay healthy. It's also to give you an understanding of what chiropractic is and what it's not, and to realize that it's its own healthcare entity. It's not a replacement for medicine, physical therapy, massage therapy, acupuncture, any of those particular things. It's truly its own particular healthcare entity. And there's a need and a necessity for those other things as well, and very often we'll use them in conjunction with chiropractic care. So what do you think? Is our healthcare system working or not? We got to know here. Okay. So in the U.S., we're number one in the following categories. The dollars spent per year on health or disease care. So watch these numbers, okay? Approximately $2.8 trillion per year is spent on health or disease care. The issue I have is the fact that 96% of that is for sick care. Very little of our money is for preventative care. And if we look at the statistics today, we really need to look at a preventative side than acute care management. Now, I'm not saying that's not important. When somebody has acute care need, we should supply them the medical care that they need. But what about preventing that heart attack from ever occurring? That's really the goal, okay? So how about the dollars spent per year on medical research? We're number one in, okay? About $140 billion per year on medical research, and rightfully so. How about the number of hospitals per capita as well? But here's the question, are we getting a bang out of our buck? So we spent a lot of money, but are we getting a bang out of our buck? In 2000, the World Health Organization ranked the U.S. 37th in overall healthcare system. 37th. Now, we're the United States of America. What do you think we should be? One. Number one, absolutely. Right, Deborah? No question in my mind. In 2008, the World Health Organization ranked the U.S. 48th in our life expectancy. Pretty dismal numbers, okay? In 2009, we were ranked 49th in our infant mortality. So we're getting worse in terms of some of these numbers. But why do you think that is? What's our focus in this country? Sick care management. Sick care management, again. Health or disease care is literally bankrupting individuals, but really it's starting to bankrupt our nation, especially when you start looking at 12 to 15% increases in health premiums every single year. It's a number that we can't sustain. We just can't keep up with it. In 2008, big pharma profits were nearly $40 billion. So the profit margins are going in a huge fashion, but yet we just can't keep up with those types of profit margins. So is our healthcare emphasis wrong? Are symptoms the key to health? What do you think? So if you have no symptoms, are you healthy?
No.
Ah, you say no. Do we rely too much on medication in this country?
Yes.
What do you think the leading causes of death in the United States are? What do you think number one is?
Cancer, heart disease.
Awesome. Here, you're good, right? Cancer, heart disease, it really depends on the study and the age group you'll see. We're going to use cancer first, heart disease second, but sometimes you'll see an age group it'll flip, okay? What's the third leading cause of death in America? What do you think?
Obesity.
Obesity is further down, stroke, okay? But physiologically, aren't those very, very similar? Stroke and heart disease? They really are, okay? Fourth leading cause of death in America is adverse drug reactions. And this is not the drug that you buy on the corner, some cocaine or whatever it may be. This is prescription drugs that actually kills the person. So 1.5 million emergency room visits per year, okay, about 106,000 deaths per year. Obesity is next in the line with about 100,000 deaths per year and causes about 100,000 cases of cancer a year, and that's only because of adipokines. Fat cells actually are inflammatory, which can push cancer cells as well. So again, take a look at this little skit from Friends.
What were those pills called?
Hexadrin.
Oh, I love you, Hexadrin. Mwah. Oh, look, it comes with a story.
Phoebe, they're like the side effects and stuff.
Say what?
You know, the
the possible side effects.
Oh my God. Dizziness, nervousness, drowsiness, facial swelling, nausea, headache, vomiting, stomach bleeding, liver damage. Now, okay, I don't recall any of this coming up when you gave me these little death capsules. Oh, I'm sorry. Extra strength death capsules.
Amy, relax. None of that stuff ever happens. They just put it on there for legal reasons.
Why?
In case it happens.
It's really funny to look at that, right? But it's true. And you hear these commercials that have these god-awful side effects at the bottom, but why do they put them on there? Because they do happen. It's no big deal if they don't happen to you, but what about your next door neighbor if that happens to the next door neighbor? So the statistics are truly staggering. If we look at the 2002 stats, when the 10 U.S. drug companies in the Fortune 500 list had combined worldwide sales of about $217 billion, only 14% of that was spent on research and development. And you hear over and over that research and development is why pharmaceuticals are so expensive, but 31% of it was on sales. So I guess the point that I would have is the fact that how about we spend more on the research and development side instead of on the sales side, and we may actually have premiums start to go down a little bit. James Chestnut, who I got my certification in wellness through, says this generation's the sickest in history. We've gone from a super species to the sickest species. We're not as healthy as the generation before. We may be living longer, but what quality of life do we have when we're living longer? Okay? So the cause of disease, is it the soil or the seed? What do you think about that one? The soil or the seed? What do you think?
Both?
It really kind of is both, but I want you to think about it a little bit deeper, and you have to choose one. So is it an A or... Okay. So watch this, okay? Let's back up. Is it the soil or the seed? It's actually, I'm not sure why it's doing that, but it's actually the soil, and here's the reason why, okay? It's kind of like your garden. If you garden and there's lots of worms in the garden, is that a healthy garden or a very sick garden?
Healthy.
Very healthy, okay? It's just like the bacteria in your gut. You should have lots and lots of bacteria in your gut to actually stay healthy. So if your body is, your immune system is very strong, okay, and all of us are exposed to some virus, will we all get it? You wouldn't. Only the person's immune system that's lowered. So really the soil is the answer, okay? And that's really the key thing with that particular slide. So where do we go from here? Well, we obviously have to get back to the basics, right? So what are the basics? Let's define health, okay? How would you define health? What would you say one thing is the definition of health?
How good you feel? Or?
Awesome. So it's how good you feel, right? That would be one component of it, okay? What else would you say? So watch. Is it how you feel, though?
It's how your body reacts to.
Ah. So how your body functions, maybe, right? So is it how you feel? Well, could you have cancer and have no symptoms? Of course you could. You could have hangnail too, right? And have lots of symptoms. If you have no symptoms, are you healthy? Again, the grapefruit-sized tumor in your lungs could potentially give you no symptoms whatsoever until all of a sudden you're starting to cough up, blood. Okay. So Dorland's defines health as a state of optimal physical, mental, and social well-being, not merely the absence of disease and infirmity. So it's not just how you feel. It's certainly not the absence of some named disease process, and it's certainly not available. It's certainly not the type of thing you want to take a drug or a surgical approach just to stay healthy. Now, is there a time and a place for a drug or a surgical approach? Of course there is. Of course there is. We would never tell you in our practice there's not a time and a place for some type of drug or surgical intervention. How about Webster's definition? It states it's a condition of wholeness, having all the body parts functioning 100% of the time since conception. But of those things, of wholeness, function, and time, what do you think is the key to health?
Functioning.
Ah, you kind of got to that earlier, okay? That's huge. Function is truly the key to health. But what controls function in the body?
Everything.
So, is it your heart? Is it your kidneys? Is it your liver? Or is it your nervous system?
They all work together.
They do all work together. But if we look at it from strictly an anatomical standpoint, you've got to look at the nervous system as the master control system of the body. Okay? You can actually have part of your heart die and still live, right? What if you've got a significant infarct in your brain? You're going to have pretty significant damage to your entire body, okay? Or at least portions of your body. Well, so what controls function of the body? Gray's Anatomy describes that the brain and nervous system controls the function of every single cell, tissue, muscle, and organ in the body. And more importantly, in my opinion, it relates the body to the environment. So when it's really cold out, what do we tend to do? We tend to shiver a little bit, right? Isn't your body relating to the environment at that point? Sure it is. Now when it's really hot out, we start to perspire, same deal. Your body's relating to the environment that it's in. But now let's switch gears a little bit and say, what if you're vomiting because of a bad tuna fish sandwich? Are you healthy or you're sick?
Sick.
A lot of people would say you're sick.
You're healthy because your body's fighting whatever was in the tuna.
You're trying to reject it. Now it's a very hard thing to think about, the fact that when you're vomiting, that you're saying, I'm so healthy! Because traditionally we're taught that we're sick. Same thing with diarrhea. You start getting, now I'm not saying there's not excessive times when there's diarrhea, but the vast majority of the time when you have diarrhea, it's because your body's trying to get something out of you, okay? But what do we tend to do in this country? We tend to take some type of medication to stop the normal bodily process from occurring. I would contend that's not the smartest thing because you're fighting the nervous system. So let's look at this picture. This is the autonomic nervous system, just showing the nerves coming out of your spine do supply all the organs. So if you have a subluxation here, a joint that has stopped moving properly and ultimately interfering with the nerve, what do you suppose it might affect? It may affect some of these lower organs, the large intestine, the bladder, the kidneys, those types of things. If you have a subluxation up here in the upper dorsal spine, or T1, T2, T3, it may affect your heart and your lungs. So does it make sense that if you have a subluxation here, you may want to also start looking at other things that it may affect? Sure. Now, if you have a subluxation here, does it always give you symptoms over here? No. The body's great at suppressing signals of symptoms. So spinal nerve distribution also, there's a peripheral nervous system where the nerves come out of the neck, supply the arms, the nerves come out of the lower back, supply the legs. And this is really the fun part when we look at this, is the fact that somebody could have leg pain and never realize that that calf pain is actually from the lower back. The left arm pain is actually from the neck. Very similar, although different pathway, when a person is having a heart attack. They may have jaw pain or left arm pain, okay? This type of referred pain. So really the foundation of chiropractic is built on the fact that the body has this innate ability, this innate wisdom to heal itself, all under the controlling influence of the master system, which is that nervous system. Chiropractic adjustments get rid of the interference to that nervous system to allow the body to function optimally, and that's really the ultimate goal at this point. So what happens if the nervous system is interfered with? Well, whatever cell, tissue, muscle, and organ that the nerve supplies will be compromised, obviously. Those are called subluxations. Now, the weight of a quarter, though, will reduce nerve impulses by up to 60%. It's one of the reasons why we'll say to you, put ice on the area. You have to reduce inflammation. If you do not reduce inflammatory changes, you're never going to get rid of your issues. So inflammation is really the ultimate culprit when we look at this entire thing. The evidence now indicates that altered nerve flow affects not only local spinal tissues, because people always say to me, well, I've got pain right here, and that's the only place it could possibly affect. But now they're describing that not only nerve flow affects local spinal tissues, but brain functions, regions that regulate pain, stress, immunity, thinking, learning, concentration, emotion, organ function, sleep, digestion, overall hormonal and organ function regulation, and neuromuscular coordination, balance, strength, and agility. It's one of the reasons why the more spinal movement you have, the healthier your brain will be. And you'll see this with children. What's a huge disease a lot of kids get diagnosed with today?
ADHD.
ADD, ADHD, right? And what do you think most kids are doing nowadays? Do you think they go out and play in the playground for 3 hours after school? Or do you think they go in and play on the TV and do nothing? It's exactly what they do. They play in their little game things or their little iPads, whatever it may be, instead of actually play a sport, okay? That's one way to make a brain mush, okay? So subluxations cause nerve interference, potential pain, and loss of health. Again, we always say potential pain because you could have no symptoms whatsoever and have a lot of symptoms or a lot of subluxations. You could have long-term degeneration and have no pain whatsoever. So 5 components of a subluxation. 1 is abnormal movement. Nerve irritations, number 2, tightness or spasm, inflammation and scar tissue deposition, and of course the last one is degenerative changes. What do you think, when do you think people go see a chiropractor? What do you think the most common time is?
When it hurts.
Yeah, when they're in pain and when they have what? Spasm, okay? Doc, I'm in severe spasm, get rid of my pain, okay? One of the key things with this whole cycle is that inflammatory cycle allowing for scar tissue, because scar tissue is something you have to break up as well. It's another reason why we'll be recommending exercises to actually help break up scar tissue so that the long-term changes do not occur, which are the arthritic changes, okay? Now, some people already come into us with arthritic changes, but again, does arthritis just all of a sudden stop on its own? No, you've got to do something to stop that arthritic change from progressing. Chiropractic care can help you with that along with your spinal exercises. So what are some causes of subluxations, would you say?
Bad posture.
Ah, terrific. Bad posture, what else?
Lifting something heavy.
Good, so no, a physical trauma, right? Okay, so let's look at these. So physical trauma, birth trauma, slips, falls, auto accidents, and in my opinion, one of the most important things is micro traumas. That's the postural changes, those bad postures. It's not the one time, though, you sit incorrectly. It's not the one time that you lift the basket incorrectly. It's the fact that we've been doing that same thing over and over and over for years. So the micro traumas are absolutely critical. Because the vast majority of people that come to see us in our practice, they'll say, Doc, I have no idea how this thing started. Right? They have no idea. And it's really because of micro traumas. Okay? What's the next one? Emotional trauma, stress at work, school, home life, relationships. Nobody has this, so let's skip it, right? This is a big one. Stress is a huge issue for us in America, okay? We tend to be a very stressed society. Again, those are all things we have to actually work on, obviously, okay? How about chemical stress? Exposure in the form of air pollutants, prescription and non-prescription drugs, smoking and alcohol. But what about the foods we eat as well? Huge component of why people get subluxated and why they get inflamed is the actual foods you take in. We do a whole seminar series on how we eat, move, think well, and sleep well series, which can help you with this particular avenue. Okay. So some side effects: nauseousness, irritability, joint pain, headaches, homicidal impulses, kidney failure, diarrhea, muscle aching and weakness, tingling or cramping in the legs, heart attack, insomnia, loss of sex drive. And the question we would say: maybe there's some other way to deal with itchy eyes. That's just for the itchy eye medication, right? You know, we joke about this stuff, but you know, you'll hear these side effects. You're like, all I want is something for my itchy eyes. All right, so watch this. Where are we going here with this thing? Speaking of physical emotional stressors, what do you think? Does that normal childbirth look stressful? 90 to 120 pounds of pull pressure on the normal childbirth. So do you think that little Johnny may get subluxated? One of the bones may actually subluxate, not move the way it should, and potentially cause some immune system function issues with the particular child? Maybe that's why little Johnny is the only one in the household that always seems to get the ear infections, always has the cold. Whereas little Susie, who eats the same foods in the same environment, same stress, whatever it may be, always seems to be healthy. Remember, it's the soil, right? It's not necessarily seed. We're all exposed to the same stuff, okay? So little Johnny may be subluxated right from birth, and that may be the problem, okay? So the majority of subluxations that we see are really a combination of stressors beyond the ability of the system to adapt. And that's one of the key components. It's not the one time you do anything. It's the fact you've done it over and over and over, and eventually the body throws up the white flags and says, I can't do it anymore. I need some help. So what do you think of this x-ray? Which person do you think would have pain? The person over here, now this is their jawline, back of the skull, jaw, back of the skull, the individual vertebrae kind of sit on top of each other like blocks. Which person would you say would have pain? The one on the right, right? Absolutely. But guess what? The one on the right may not have pulled that final weed in their garden to cause pain. And we've seen case after case like this, where the people come in, they have no history of long-term arthritic changes, no history of significant pain, and lo and behold, you take the x-ray, and they've got lots of arthritis. And then they're like, just from the pulling of the weed last week, I got this arthritis. No. This took years to develop. You've worked hard to get this, okay? All right. So how do you know if you have a subluxation? What have I said not to think about the whole night? Pain, right? But isn't it a good indication that you may have a subluxation? So if you have pain, you may be subluxated. So if you have pain and you say to yourself, well, gosh, I'm not sure why, first and foremost, let's get checked for subluxations. Obviously, the very best way to determine is a good chiropractic analysis or a specific chiropractic analysis. When should you get checked for a subluxation?
As early as possible.
Yeah, as early as possible. You don't want things to set up and scar in, okay? How about at birth? Another good time, little Johnny could have used that, right? With 90 to 120 pounds of pull pressure. How about when symptoms of ill health develop? Another good time. A lot of people, that's when they come in to see our practice. How about our preventative wellness basis? Makes the most sense, okay? Don't wait for a problem to occur to start actually getting care for that. And I see this all the time when people have a significant healthcare issue. They might get diagnosed with high blood pressure or some type of kidney function failure or cancer. All of a sudden they want to do, let me start juicing, let me start doing this, let me start doing that. And I say to them, my gosh, why didn't you start this before you ever were diagnosed with this kind of stuff? The impetus wasn't there, right? There was no need yet. I didn't have a diagnosis yet. And the diagnosis often is the thing that pushes people. So who should be checked for subluxations? Everyone with a spine, right? In fact, we don't take people without a spine in this practice. So anyone who wants to get well and stay well with the least amount of drugs and surgeries, take advantage of the ability to get well before it's too late. And that's one of the things I love to reiterate is the fact that don't wait till you have a significant problem to actually start having your spine checked. So what do doctors of chiropractic actually do? Have we talked a lot about back pain, neck pain, or headaches tonight? No. I don't think we've said back pain once, right? And the reason why is because chiropractic is not about those things. Do we see a ton of back pain? Of course we do. Do we see a ton of headaches and neck pain? Of course we do. Are we really good at it? Yeah, we are. But it's really about restoring function. So you won't see us asking about your symptoms every single visit because we're more concerned about the function of your spine. Get the function back, and guess what starts to go away? The symptoms. It's all about function. If you get the function back, things start to just heal itself. So there's 3 healthcare choices in our practice. One's initial intensive care for relief and stabilization. 2 is reconstructive care to unravel the layers of traumas that we all have. And of course, wellness care to allow the nervous system to function optimally for your spine. Again, I say it over and over and over, keeping the spine healthy will allow that nervous system to function optimally, and that is the ultimate goal, okay? So on the road to wellness, nobody realizes it, but on a daily basis, we're asked this question hundreds of times. And you're making these decisions hundreds of times. Are we going to go towards optimal health, okay, or poor health? So watch, when I drive into my practice, I have the ability to drive in and take a left towards Dunkin' Donuts, or keep going and eat my apple and take my shake, right, my protein shake. So I have that choice every day, right? And hopefully I make more of this choice, keep going straight, than this way, because obviously that would be a poor healthcare choice. But so watch. Did we park further away at work today, or did we park right up close so we didn't get that little extra exercise? Did we take the stairs? Did we go ahead and eat 2 pieces of cake instead of 1 piece of cake? Did we go for seconds versus just 1 plate of food? All of these types of things. Did we flip the person off that cut you off on 787 today? All of those types of things we're asked every single day. Our contention would be the more times you go towards optimal health, you're just going to be healthier. And think of your health as a bank account. The more times, just like your own bank account, the more times you put $1 in it, the more money at the end of the day you'll have. The more times you choose optimal health decisions, the better you're going to be down the road. And now when you're 65, 75, you can actually draw from that healthcare bank account, right? If you're extremely unhealthy going all the way up through and you've never really put anything into that healthcare bank account, it's very hard to draw from that when you have a significant illness or a disease process. So how do you stay well? Well, in my opinion, eat well, move well, think well, sleep well. We talked about it a little bit earlier. It's a seminar series that we do in the practice. It's absolutely wonderful. That is also online already. Thank you to Nora. Okay, but it's a tremendous seminar series that you can view online. How does Greenbush Chiropractic help you stay well? One is quality chiropractic adjustments. 2 is nutritional coaching. The finest supplements that have been reviewed and used by all the doctors successfully. Numerous free presentations, including that life-changing Eat Well, Move Well, Think Well, and Sleep Well seminar series. The complete commitment to the health and wellness of our practice members and, of course, our community. So a final question. Who do you know that just needs to be checked for subluxations? Okay? People just simply need to be checked, and that's all there is to it. Any questions? Because we're going to finish with a short 2-minute video.